take you through this next lesson of managing medical technology. So normally, if we were meeting in class, we'd be going through an exam review. So what I'm going to do is make that exam available for you to review for a period of time and allow you to go over the questions that you missed and let me know if you have any questions or concerns on any of the questions there. Okay, so when we're taking a look at a patient room, and specifically, some of the rooms such as surgical rooms where there's a lot of medical devices, who's going to keep track of all of these devices, all these different machines? Well, that can sometimes be more difficult than you might think. What devices are taken care of by BMETs? What devices are taken care of by facilities and nurses and other things? IT, for instance. So one of the first things we have to decide is this a medical device? Sometimes it's very clear, yes, this is used as a medical device and it is a medical device, but sometimes it's not that clear. So we need to be able to categorize this equipment and then determine what the risk level of that equipment is so we can determine who takes care of it. So when we're going over what is a medical device, we want to discuss a couple different things. So as you go in my courses, I want you to look at this discussion question. These discussion questions are in my courses so that you can interact with your peers. So go through these questions, look through them, and respond to your classmates to get an idea and a sense of what a medical device is. Okay, so there's a couple different ways to categorize medical devices in a hospital. We're going to categorize things as clinical devices, and within that category, we're going to have two subcategories. One is life support, one is non-life support. We're going to have equipment that's utilities, so power, water, gas, HVAC, and communications, and then general, things that you might find in an office, things that people are normally going to take care of or do preventative maintenance on. Okay, so for instance, right here, we could ask, what device is this? Who would take care of it? So this would be a generator, and it would be taken care of by facilities. What type of devices are these? Are these medical devices? These would normally be, this is a gas manifold, and this would normally be taken care of, once again, by facilities. Okay, what type of device is this? So this is a little hard to see in the picture, but this would be a entertainment type system interaction, so the patient can interact with these displays. Now, it may control the TV, but it may also control access to information that the patient has for watching on treatment videos. So maybe there's some release treatment information about who to contact, what to do, maybe physical therapy type instructions, maybe other types of instructions that could be related to treatment. This type of device can depend on the hospital, whether it is taken care of by facilities or by the BMETs. I find often more and more they are being taken care of by the BMETs for various reasons. Once again, this is a nurse call button. So I find, once again, this is a difficult device to know who takes care of it. Oftentimes the BMETs will do it. It is considered a medical device often, so I usually see them taking care of it, but sometimes communications IT will take care of these as well. So, determining if BMET's going to take care of it, probably the main question you're asking, is this a medical device? And then there's going to be a discussion of, okay, if it is a medical device, who's going to take care of it? And in certain cases, maybe facilities, for instance, sometimes take care of hospital beds, even though those are medical devices. Sometimes that's just whose responsibility is. That's what the hospital is set up as, and that falls under their umbrella. Sometimes it's the BMETs. IT and BMET sometimes are even joining together now. So it can vary from hospital to hospital or facility to facility who's taking care of these devices, but it's still important to know, is this a medical device or not? So when we get these devices in, we need to know, okay, what kind of performance and safety tests do we need to perform? If something is a temporary piece of equipment, sometimes hospitals get loaner equipment. If it's going to be used for less than 90 days, it doesn't need to be added to the facility management system. So, for instance, you get a loaner, a portable x-ray machine, that does not have to necessarily go into your facility's management system. However, some hospitals will choose to do that. Some facilities will choose to do that nonetheless. One thing to think about is, is this life support equipment? Would failure of this device result in death? And is this device going to be used for treating a patient? So, for instance, is this infusion pump a life support device? Well, typically, no, this is not going to be used for life support. If this fails, yes, the patient may not get the medicine that they need, but there's ways that we can work around that. If it fails, typically we get an alarm and we'd have time to provide any medications that would be needed to the patient. So no, this would not be considered life support equipment. For a ventilator, yes, this is considered life support equipment. The patient needs, in this case, if they're hooked up to a ventilator, that is going to be something that's maintaining their lungs. That their lungs need to be functioning for them to maintain their correct breathing and maintain oxygen, which is critical to their sustaining their life. Okay, so as we go through different devices, we can look at their risk. And that risk has to do with the clinical function, the physical risk of the device, how often that device is used, how often problems occur, and any manufacturer guidelines. So, does the function of these devices pose a risk? So we have a PCA, a patient care analgesia pump, one that dispenses typically pain medication. We have a patient monitor, and we have a C-arm for x-ray. So does the function pose a risk? Well, in this case, you could make an argument that the pain pump, if you overdose a certain pain level, that could pose a functional risk. That an overdose of a drug could be a very serious risk, so that would be considered a fairly high risk device. The x-ray in and of itself, the function, even when it's working correctly, is a risk. So anytime a patient is exposed to x-rays, they are taking on radiation, which is a type of risk. So both of those the function itself has a risk associated with it. The patient monitor is not going to pose a risk. It is there to diagnose. It is not a risk in and of itself. The leads are not a risk. There are not major safety issues that occur because of the use of the device. Next question is, does the physical geometry or motion pose a risk? And you could always imagine some worst case scenario where an infusion pump is knocked over and hits somebody, or a patient monitor falls off a rack and hits somebody. And those are real risks. They don't happen very often, and it's not typical. That would be something that would not happen normally. Whereas the C-arm, if it rotates incorrectly or is driven into something, it could actually pose a pretty serious risk. So the motion of that device is a much higher risk than the other two. The geometry of it is a much higher risk. And next question is, would maintenance and inspection prevent failure? So if we look at the pump, the patient monitor, and the C-arm, for all of those things, maintenance and inspection would prevent failure. We can anticipate preventing failure of those devices by doing maintenance and inspection. Okay, so one of the questions we need to ask ourselves when we're looking at risk is, does the device have some sort of history of failure? So one thing we can do is do an FDA recall search, and I'm going to show you how to do a search for the Alaris 8100. So we're just going to look for Alaris right now. And you'll look, this is the same pump we have in the lab, the CareFusion Alaris Pump Module 8100 has just had a recall recently. This was on March 5th, 2020. So the recording of this video is a fairly recent recall. So this has been opened up, and you can find out all the details of that recall through here, so you can figure out what kind of risks are associated through that recall. Another way that you can look at, does the device have a history? Maybe something's not showing up in the FDA research, and FDA website, but sometimes you can go to MedWrench, which is sort of a tech forum and a marketplace, and we could go to our CareFusion Alaris pump right here. We can request parts, do all these neat things. But one thing that's nice is there's a forum, and sometimes people will post like, hey, we're getting this error message. Hey, we're getting this issue with our pumps. And you can get an idea of sort of what devices may be more problematic by looking at some of the tech forums and understanding what people are seeing with those devices. Okay, so anytime you're doing maintenance, you want to make sure you locate the service manual. And you can do that by using the OEM provided paperwork or website. A lot of times Frank's Hospital Workshop will have the service manual, or even MedWrench often has the service manual for different devices. So one thing to note is not every facility is going to choose to handle every device. Many hospitals don't really have the capacity to handle the tens of thousands of devices that they may have in their system. So they can often hire a OEM or a third party to do the service for that device, especially a lot of times high-end devices, maybe x-ray equipment or anesthesia equipment. It's a little more technical. They'll have someone have a service contract on that so that they don't have to keep all their employees up to certifications for those particular devices, which can be very expensive. There's also insurance programs that you can have where instead of maybe fixing something, you don't want to fix it. You just say, okay, once this device is not working, we send it away and we get a new device. So it's a way of just saying, okay, it's a retirement strategy. Instead of trying to repair something, we just get a new one. Okay, and that's all we have for this lecture.